Hello everyone, is childbirth supposed to be painful? I don't have the answer to that. This question has been asked for centuries, more or less at the same time as when the pharmacological ways to reduce pain in labor became available. And I don't know whether childbirth should be painful or not, but I know that pain is a word that is a lot associated with labor and birth, always basically, and I want to give you in these videos some other ways to look around the concept of pain so that you can embrace it and get through labor and birth yourself. Let's go into the video now. Hello future parents, welcome into this video where we discuss once again all about pain and what it is really involved with pain in labor and birth. If you don't know me already, my name is Ilenia, I'm a midwife. I've been a midwife for more than 7 years now and I currently live in the United Kingdom. So if you like any type of motherhood content like breastfeeding, pregnancy, birth, anything you like, do subscribe to the channel because I post a video every week about it, so come along in the community. Today's video, as I was saying, is about pain and what causes pain in labor. Well, the protagonist is the uterus. This muscle in the lower cavity contracts. It's a bunch of muscle fibers that contract and causes pain. It does the same also during your menstrual period, for example, every month. And some women describe it linked to the back, other to the tummy, to the front of the belly area. It's very subjective. And it's the same sensation involved in labor, obviously in a bigger scale because the uterus is bigger, there is a baby inside, a placenta and the amniotic fluid, etc, etc. So the sensations are different and I would say stronger, definitely stronger than the menstrual cramps. The uterus is an involuntary muscle like the cardiac frequency or the bowel movements. When I say involuntary, it means that you cannot control it. The uterus will start to contract when you or your baby decided, but you cannot control it. You won't be able to control the muscular activity linked with the uterine contractions. That's an interesting characteristic because it's the only body function in life that is physiological. It's normal, it's a body function. Every mammal gives birth, every species gives birth to an offspring, and this usually causes pain. But it's the only physiological function that causes pain, and I don't know why, to be honest. It's nearly like there is a ritual of passage that you get pain, but then at the end you get the baby. Some people believe that pain therefore is like something natural that you shouldn't be afraid of, and others say that is like pointless and could easily be avoided with some help, and therefore they don't want to feel it, and they're both very respectable. Obviously, I'm a midwife, so I believe in physiology and I believe there is a meaning and a purpose to the contraction pains. So we're going to see why is it and what can you do to get to the idea that at the end of your labor there is a baby and that you can get through this pain. Some women don't even describe it as pain. A lot of women would say their labor was painful, the majority of it, and don't get me wrong, it will be painful unless you're like one of a million women that is lucky enough to don't describe it as painful. But some women do describe it, instead of saying that it was painful, like uncomfortable or like pressure. I've seen so many women myself laboring, smiling, and then giving birth and saying that they could do that right away again because it was not painful at all. It was intense, but it was not painful. And why is the pain perception so different? Why there is a woman coming into the hospital at 1 centimeter dilated because she cannot cope with the contraction, at the same time there are women birthing at home with no pain relief whatsoever? Why is it so different from woman to woman? What makes a perception of pain so different for each one of us? My answer is that the pain perception comes down to the experience of the pain, to how much you expect pain and how much you are prepared for it. Let me explain you better. Think about sexual intercourse. Think about the difference that it makes when you're prepared for it, when you do it with someone that you love, when you do it in the right mood, in the right time of the day, with your right mindset, compared to when there is a violence and abuse, or even simply an intercourse that you're not very keen to have in that moment. Think about the difference that it makes in your pain perception. One will be a pleasure experience, another one will be painful, and that says a lot. Another example that I can give you is when you try to insert a tampon during your menstrual period. How painful will it be if you're like tense and rigid and you're not comfortable when you insert the tampon, compared to when you're nice and relaxed, maybe in in a better position and you're ready for it and you've done it many times and you know what to expect. It makes all the difference in the world, and it's the same thing with labor and birth. I've discussed about vagina and the reproductive system because it's what involves childbirth. But it's the same when you prepare, for example, for an exam, and you're so prepared and you studied so much that you know all the books. How easy will that exam be compared to your colleague that did not study at all, and she'll find it so hard while you'll find it very easy? It's exactly the same for the labor pain. Also, the place where the experience has a role when it comes to pain perception. Think about again the intercourses when they take place in a place that you know, that you're familiar with, that has dim lights, no noise, or like very low voices, compared to obviously a room like a hospital room with people that you don't know, that are watching you, with people talking about their own things, and with very bright lights. Obviously the pain perception will be alterated according to where you are, and this is why women at home sometimes don't need any type of pain relief, but they just need their own environment to get through labor, because it's a place that they know and they cannot be interrupted and they can feel at ease in that place. Also, most important is who is with you. Is your birth partner the right person to be with you during labor? Do they know how to treat you when you're in pain? Do they know what to do for you when you're struggling? Do they know how to support you physically and emotionally? How much difference does it make having someone that knows you, or also having like a midwife that is calm and relaxed? Maybe you come into the hospital or you call your midwife and you're desperate and you're struggling, and then she just gives you some reassuring words saying that everything is normal, everything is going well, and you'll be fine, those contractions are good, they're bringing you the baby. How much difference does it make when you have someone close to you that is not panicking, that knows what's happening, that is there just to support you and to help you to get through what you're doing? You have to keep in mind that pain in labor is different from any other pain you're going to experience in your life. When you hurt yourself, when you break a bone, when you have to have a cavity removed, or even when someone hurts your feeling, you're going to feel pain, and that pain is a signal that your body gives you that something is wrong, that you have to fight, that you have to change something. It's an alert, it's a response that your body does to let you know that something is not right. Pain in labor is not that. When you have pain in labor, we don't get worried, nothing is going wrong. It's your body doing its normal body function. Obviously, it's hard to switch that concept because, again, labor is the only body function that is painful. So I get that, but you have to put yourself in the view that that pain is good and it will bring you a gain from it, will bring you a baby at the end of it. Also, it does not have the same pattern as a pain that you might have when you have a cavity or you break a bone. Labor pain is intermittent, so there is always a peak, and then the pain will go down, and there is a break in between, there is a rest that you can take in between. The pain is harmless, it does not hurt you, it does not hurt your baby. It's anticipated, you know that it's coming, you know that when you start off contractions you get more of them and closer and longer, you can prepare for it. And also, you can do something to change the perception of the pain. You can change position, you can change the environment, you can do so many things to alterate the perception of that pain. Now, don't get me wrong, there are some pains that are linked, for example, to babies that are not in the best position. Maybe they're OP, occipitus posterior, or there is asynclitism, maybe meaning that the baby's head is tilted in a way that it causes you more pain. And I get that, and I know that there are some labors that are definitely harder than others, but you can get through them as well. You just have to correct what is not going right, and that's why you need to have someone around you that knows how to identify those situations. There is a big distinction to do between pain and suffering, because as I was saying before, the pain is physiological, is an expression of your body that tells you that something is happening, that everything is going well. I'm talking about labor, obviously. You might be yelling, crying, screaming, moaning. It's fine. It's just a normal manifestation of your physiological pain in labor. It's like when you go to the gym, you know that you can squat or lounge and you're fine with it. You get to the point where you're tired, but you can keep going because you know that at the end of it, maybe tomorrow you get a better body, you lose weight, you do whatever you want to do. So you do one more series and you're tired, but you know that you can do it. You can take a break and then do another one again. You could stop, but you want to do more because you know that the more you do, the closer your goal will be. And that's what I want you to compare labor to. A very intense training at the gym where you know that you can stop at any point. For stop, I mean maybe getting help, but you want to try to keep going because you know that you'll get a better result at the end. Suffering instead is a deeper emotional pain. It's where you get to the point where you feel there is a threat to your body or to your baby, where you lose control, where you're distressed, where you feel like you're gonna die, where there is a very strong inability to cope anymore. And that's the point where you definitely need a bit of extra help, and that's fine. Some labors are harder than others, and some women need more help than others, and that's absolutely fine. Everyone is so different, and that's why, again, you need someone that is able to differentiate pain from suffering. And if they don't listen to you, just say that you're struggling, that you're suffering, that you can't do this anymore, because that's definitely a signal that there is something else going on that we need to help you with. I hope that it made sense. I hope that it gave you a little bit more reassurance if you are approaching your due date, if you're going into labor soon, so that you can get through it and have your beautiful, lovely prize at the end that is your baby. It's all for this video. I'll see you next time. Bye bye.